I'd like to welcome and thank everyone who is here with us today. From our distinguished faculty, honored guests, friends, family, and administrators. Each and every one of you has made an impact on the graduates that we are celebrating today. Class of 2021, we made it. We have successfully written this chapter of our life. From our brief time in person to virtual classes, club meetings, throughout our internships and research, we have constantly challenged and redefined what communities can look like and what they are capable of accomplishing when they come together. We saw the power of community very early on. On our first day of orientation, around 300 of us packed into subways, trains, and planes, kind of like sardines, and arrived at NYU's campus. At that point, masks, hand sanitizers, and social distancing were not yet on our horizon. No, when the class of 2021 first arrived at NYU, we immediately broke out into teams and sought to build the tallest spaghetti and marshmallow tower that Manhattan had ever seen. And although technically only one team could build the tallest tower, within our first few hours of knowing each other, we collectively showed that through the power of community, we can foster innovation and overcome any challenge presented, even if that challenge was tying together two strands of spaghetti. This sentiment has carried throughout our journey at the School of Public Health. There have been countless times during this past year where it felt like the very fabric of democracy was being tugged at and challenged across the world. The continued politicization of public health initiatives has posed a threat to our fight in achieving equity. And yet, this past year, the members of this class have shown that our work is far from done. The members of this class have continuously pushed for and advocated for increased access to healthcare. And while at times we may have felt at loss for words to explain and grasp the world around us, this year had its share of accomplishments and historical moments. Even in our most recent election, we witnessed more people come out in vote than any other time in American history. Across the world, we have seen and heard the voices of millions coming together to march against systemic racism. Protests against gender-based violence were louder than ever. And throughout all of these movements, we were able to leverage the power of technology and develop toolkits and guides as a means of connecting and empowering activists from across the world. This year, public health practitioners were able to revitalize efforts to tackle communicable diseases. Some of us have even been fortunate enough to receive doses of one of the fastest vaccine developments and rollouts in history, one of which was funded by the backwoods Barbie herself, Dolly Parton. I want to take a moment to thank all of the frontline and essential workers in our presence today. Throughout this pandemic, it was your tireless efforts and commitment to serve that gave care, strength, and protection to so many of us in this community. Class of 2021, I have no doubt in your ability to create sustainable solutions to address health challenges. In an unprecedented year, you all continue to believe in something. You believed in the power of community. You relentlessly championed your cause. You put theory into practice, and now you are inspiring others to follow suit. Let's continue to stand up in the face of inequality and inequity, continue to think unconventionally, give bountiful compassion, shatter the status quo, and fight for a better tomorrow. While our world may look a little different than it first did when we began this journey, it will be your resiliency and your conviction that will pave tomorrow's path. Class of 2021, this is our moment. Let's get out there and get to work.
During Professor Dahlia Heller's class on public health and the criminal justice system, I inquired about how dispersed protests, a group of activists, or even a trending social media movement could possibly spur the dramatic changes needed to implement widespread change. How could the voices of these individuals have such power to realize interventions and policies aimed at improving health outcomes of an institutionalized population? Professor Heller responded, "Change does not occur in a vacuum." As global public health students, we examine diverse elements of change with the intention of providing improved health outcomes. We considered the influence of stakeholders, including multilateral organizations, public health professionals, and people directly affected by these health events and reforms. We analyzed how the environment affects our health. We used statistical methods to find the significance, prevalence, and incidence of health issues afflicting global populations. We epidemiologically model and study disease to propose interventions based on policy, education, communications, technology, and counseling. These past few years at NYU, I have had an incredible opportunity to study global public health with a concentration in history. In addition to the public health curriculum, I have learned from inspiring professors about the historical intersections of public health, race, economics, geopolitics, medicine, and social justice. This course of study is centered around the emergence of healthcare systems, historical inaccessibility of care, and medical experimentation on communities of color, along with the strides made by advocates for social justice, reform, and abolition. One of the most profound takeaways as a GPH student has been understanding the ways in which structures and societies took shape and the effective use of this knowledge to implement changes that generate positive health outcomes. Pairing a global public health major with a concentration in either the hard sciences, social sciences, nursing, social work, or other areas is unique to NYU's College of Global Public Health. These areas of study, when combined, have offered us a holistic approach to comprehending and improving well-being within society. Living through the devastation of the COVID-19 pandemic has provided unprecedented advantages to us as students of public health. We have used this experience as a case study to examine how our current state of global public health emerged and responded from a variety of interdisciplinary perspectives. Our world has been turned upside down. So many have lost their lives, livelihoods, and loved ones as a result of the pandemic. My condolences to all who have experienced these tragic losses. We have made it through a year of struggle, worry, isolation, but also of study, innovation, and community in our changing world. Experiencing this disease that crosses class and race barriers, much like the 14th century bubonic plague, the 19th century cholera outbreaks, and the 20th century Spanish flu, has both fostered a distinct shared experience and has highlighted systemic disparities that continue to cause disproportionate health outcomes. There is no doubt that our class is well equipped to persevere through this extraordinary health crisis. Our determination, studies, and research continue to embolden us to put an end to the coronavirus pandemic, guaranteeing readiness to address future disease outbreaks while ensuring equity and accessibility. Professor Heller is right. Change does not occur in a vacuum. As public health graduates, we have the skills to initiate impactful change that will improve health outcomes. This past year alone has shown what we are capable of with the courageous anti-racism protests and our contributions to the ongoing discourse and research as university students affected by such monumental historical events. I would like to recognize our dedicated professors and GPH faculty who, as public health professionals, uniquely recognize the significance of education and its associated positive outcomes. With this framework, they have delivered an unmatched education to prepare us for the next step in our careers. I would also like to thank my friends and family who continue to support me every step of the way. Los quiero mucho. My fellow GPH soon-to-be alumni, we are the catalyst for crucial, necessary change in global health. We are the future of public health, and that future starts right now. Congratulations to the Global Public Health Class of 2021.